This week, there was alarming new testimony about the security of the Obamacare website. Cyber experts told Congress the site is vulnerable and personal information of Obamacare consumers may be at risk. One of those experts is David Kennedy, founder of security firm Trusted Sec. Before that, he worked for the NSA and the Marines. Mr. Kennedy, you testified before Congress in November, and you said that the website was very vulnerable to potential hackers. Now, after it is supposedly new and improved, you testified once again this past week before Congress, and you said the situation is even worse. Explain.
Well, when we testified in front of Congress in November, Chris, what we learned was that, they had rushed through what we call the software development lifecycle, where they actually build the application. And so when you do that, security doesn't really get integrated into it. And what happened with the rocky launch in October is they slapped a bunch of servers in trying to fix the website just to keep it up and running so that people could actually go and use it. But the problem is they still didn't embed any security into it. So when you have another, few hundred developers actually writing code to try to keep the site up and running, and you increase the line count of code, it increases more and more exposures, and that's what we saw here over the period of time, and that's what we testified on. It's much worse than what we saw back in November.
Well, I want to ask you about that and how you know that, because you say you did not hack the site, and yet you say you could access 70,000 records of various people who have signed up for health care at the website within 4 minutes. How do you know that if you haven't hacked the site?
And that's a great question. There's a technique called what we call passive reconnaissance, which allows us to query and look at how the website operates and performs. And these type of attacks that I'm mentioning here in the 70,000 that you're referencing is very easy to do. It's a rudimentary type attack that doesn't actually attack the website itself. It extracts information from it without actually having to go into the system. Think of it this way. Think of something where you have a car and the car doors are open and the windows are open. You can see inside of it. That's basically what they allow you to do, and there's no real sophistication level here. It's just really wide open. So there's no hacking actually involved. And 70,000 was just one of the numbers that I was able to go up to. I stopped after that. And I'm sure it's hundreds of thousands, if not more. And it was done within about a 4-minute time frame. So it's just wide open. You can literally just open up your browser, go to this, and extract all this information without actually having to hack the website itself.
Let's talk about the information you say that you could access if you were to actually hack the site. Names, addresses, social security numbers, birth dates. And you also say that because Healthcare.gov is linked to the IRS and to the Department of Homeland Security, you could also get in and see what they had to say about the individual person who had signed up. How do you know that? Again, how do you know that you could get this and even get into IRS and get into DHS? And if, in fact, that is the case, what could a hacker do with what seems like an awful lot of private information?
And that's a great question. What you look at for when you assess a website, and I've been doing website security for a number of years. We basically break into websites all the time, and this is my area of expertise. And what we do is we look at problematic areas around the website. And if you're seeing these type of exposures just on the website, just by looking at it, there's a much more larger problem on the inside, and it's 100% certainty because of how the website was designed and how it was architected and how it was sped along. They're problematic areas. I use the example in Congress. If a car is driving by, and I've been a mechanic for 14 years instead of security, and the engine's making clanking sounds, there's blue smoke puffing everywhere, and there's oil leaking, you probably have a good understanding that the engine itself is bad. And that's what's happening here in the Healthcare.gov infrastructure. And you have all of these different companies. It's not just CGI, and it's not just HHS and CMS. It's a number of different companies that all came together to kind of mash this thing up to make it what it is today. And you're seeing that happen right now. So underneath it. Now the problem is, if you look at the integration between the IRS, DHS, third-party credit verification processes, you have all of these different organizations that feed into this data hub for the Healthcare.gov infrastructure to provide all that information, validate everything. And so if an attacker gets access to that, they basically have full access into your entire online identity, everything that you do from taxes to what you pay, what you make, what DHS has on you from a tracking perspective, as well as obviously what we call personal identifiable information, which what an attacker would use to take a line of credit out from your account. It's really damaging, and I think it's one of the largest websites in history that we have that has this type of level of access into our personal lives.
Now, Mr. Kennedy, the Obama administration is not happy with your testimony, and in fact, they're pushing back very hard on it. The chief security officer for the website, who herself was very concerned about vulnerabilities back in October when the website was launched, now says that it has been fully tested and that it is secure. This is what she said when testifying before Congress.
This security control assessment met all industry standards, was an end-to-end test, and was conducted in a stable environment that allowed for testing to be completed in the allotted time.
Ms. Fryer now calls for full certification of the site. She says it's secure, sir.
I have to completely disagree with her, and it's not just myself that's saying this website's insecure. It's also 7 other independent security researchers that also looked at all of the research that I had done and came to the exact same conclusion. And these are folks that work really well in the industry. They're highly respected, have an extensive experience of working for the government. And you know, if you read the testimony and you read what she had actually said, is she said that it's done end-to-end security testing. They don't say what type of testing that is. It could have been an audit that just looks at paperwork. It could have been, you know, really rudimentary testing that looks for just basic things. But what's pretty evident right now is that the site itself is not secure.
All right.
It's much worse off.
All right. Well, let me talk about another complaint, because another government official from HHS says that for all your claims of vulnerabilities, there have been no successful hacks of the website so far. Here he is.
No, there have been no successful attempts of where anyone has been able to attack the system and penetrate it.
Question: if there are so many gaps and the system has been up since October 1st, why hasn't anybody exploited them?
And that's great. This is one of my favorite ones out of the whole testimony. And so what they had said is that there's been no successful attacks that they've been able to detect. If you look at, there's a November testimony on Congress that basically said that a third-party company was contracted to build out what we call the Security Operations Center, which is what would actually detect these types of attacks. As of November, it hadn't even been started yet. So if you look at how long these security operations centers take to put into play, it takes several months, if not years, to actually implement and fully be able to detect attacks out there. So as of November, we have no modern detection, and that, from my understanding, is still not happening to this date. So they're accurate in their statement. They haven't detected any attacks on the website because they don't have the capabilities of detecting. And just to throw it into comparison, it said that they only experienced 32 actual attacks on the website. They don't say what those cause for alarms are, but just a pure statistic. If you have a website that faces the internet, just purely, not popular, especially not as popular as Healthcare.gov, you're going to exhibit over 200 attacks per week on that website just based on sheer volume alone. So the 32 mark just shows another capability they don't have, unfortunately, on the Healthcare.gov website.
All right, you talk about the fact that a lot of independent cybersecurity experts side with you about how vulnerable the site is. Well, the administration talks about an independent cybersecurity expert who says unless you have personally hacked the site yourself, and you say you haven't, you can't possibly know basically what you claim. Here he is.
If none of us here built Healthcare.gov, if we're not actively doing not a passive vulnerability assessment, but an active vulnerability assessment and doing penetrations and running that exploitable code on Healthcare.gov, we can only speculate whether or not those attacks will work.
Mr. Kennedy, the administration says that your testimony is based on assumptions, not fact.
And I have to disagree, and the other 7 security researchers would also disagree as well. Unfortunately, Mr. Krush is not a web application security person. He focuses more on higher level security audits than anything else. And it's not to throw into question Mr. Krush's experience. He does some great stuff with veterans for security training and things like that. But he doesn't focus on application security, and that's absolutely false. You can definitely tell how secure a website is without actually penetrating into it and hacking the website. And I wasn't the only one that agreed on the panel. There was 3 other gentlemen as well on the panel that agreed with my assessment as well.
Yes, sir. I want to ask you, and I need a 10-second answer here. Since you have testified, has the government gotten in touch with you and said, here, come on in and show us how weak our website is?
Absolutely not. They haven't. And it's been offered, and we would do it for free to help out. Unfortunately, there's been no contact from them.
Mr. Kennedy, thank you. Thanks so much for joining us today. And we'll keep an eye on how the healthcare website is doing. Thank you, sir.
Thank you, sir.
Coming up.